Hi everyone, welcome to POC Nurse. My name is Gozi, and in this video, I want to talk about troubleshooting tips for wound vacs, especially when you're in home health. When you're out there, you're by yourself. There is no senior nurse for you to call into the room to help you with your wound vac if it's not working. You don't have that nurse that's really good at wound vacs to call into the room to help you with your wound vac patient. You don't have wound care with you to help you with your wound vac patient. You really have only yourself to rely on and whoever you can call on the phone to walk you through the process of troubleshooting. So these are some of the tips I've learned while doing wound vacs, and they really do come in handy when you're doing wound vac as a home health nurse. Okay, so why wound vacs in the first place? So wound vacs help wounds heal faster. Um, they help big wounds close. They also increase blood flow to the wound bed. It increases the development of granulation tissue in a big wound. And they also help with removing drainage from a wound. So these are some advantages of using a wound vac. Now, I want to tell you about an experience I had with a wound vac. So remember, I'm out in the field, I'm by myself, I don't really have anyone with me to help me. So this will kind of be the first time I'm totally going to do a wound vac by myself. I don't have anyone to depend on, but I'm thinking, I've done it a couple of times, it should be okay. So I went into this patient to change the wound vac. I'd called the patient prior, asked the patient to take their pain medication because the procedure could be quite painful. So I got there, I took off the old dressing, cleaned the wound as ordered, window paned the wound. I put like a transparent film drape around the wound, like a Tegaderm type dressing around the wound to protect the edges of the wound. I put the foam in there, the black foam in the wound, covered the black foam with a transparent film tape again, and then I cut a hole um, in the transparent dressing, put the sensor track pad on it, connected it to the wound vac, and turned the wound vac on. And I'm staring at my black foam. I'm waiting for it to, you know, collapse and compress into the wound, and then I'll know I'll be done. Nothing is happening. So I was pretty sure there was no air leak in this wound because I taped it very nicely. I taped it all over. So I figured, I'll just change the dressing again, and this time I'll put more tape, keep an eye on where I'm putting the tape and all that jazz. So I did all of that. Still, it wasn't working. Now I am out in the field. I don't have a senior nurse to call into the room to help me. I don't have wound care to call to show me what to do with this patient. And in the hospital, we didn't do, well, I didn't do wound vacs that often. I didn't, and if there was a wound vac, I'd call surgery to come fix it or do whatever needs to be done with the wound vac. So I'm there thinking, what do I do? Because I changed the dressing a second time and it still did not work. So I'm thinking there must be a problem with the machine itself. The machine has to have a problem. So I decided to call the Activac company, and they were so nice. I called the company. It took a while for me to get a representative on the phone, but someone came on the line. I explained what my problem was, and I said, I think there's a problem with the machine. And the person on the other end of the phone said, well, I don't think it's the machine, but we're going to troubleshoot. I say, yeah, that's what I want to hear. That's what I want to do also. Let's troubleshoot. Now, I didn't say this out loud to him, but I said it in my mind, having the feeling that, okay, this issue is going to be resolved and I'm going to be on my way to my next patient. So the first thing he had me do was test the wound vac itself to make sure it was working. And this is where my very first tip comes in, because after I learned this, I always did it for all my other wound vac patients. I would always test the wound vac first to make sure that it was working. So when you get your new canister out of the bag, you can see I have two pictures on the screen here, one with a red circle and one with a green circle. The one with the red circle has a cap at the end of the wound vac canister. In the other picture with the green circle, the cap has been taken off. Now I'm going to show you a video of, someone taking the canister out of the bag and taking the little cap off. So here you can see the canister is out of the bag. Now here's the little cap coming off. Now that little cap is a diagnostic tool. And here's what the Activac representative had me do. He asked me to attach the canister to the wound vac machine. He asked me to leave the cap on the end of the wound vac of the canister tubing. And then he asked me to turn on the wound vac. I did everything he said. I left the cap on the end of the canister tubing. I turned on the wound vac, and the wound vac went from 0 millimeters of mercury, like you can see on the wider picture. And on the darker picture, you can see the wound vac is at 125 millimeters of mercury. So when I left the cap on and turned on the wound vac machine, the wound vac went from 0 millimeters of mercury to 125 millimeters of mercury suction pressure, which means that the wound vac had no issues. It was working well. So that's tip number one. Um, Anytime you feel like there's something wrong with your wound vac, just leave the cap on the end of the canister tubing and turn on your wound vac. If the pressure goes up to 125 millimeters of mercury, there's nothing wrong with your wound vac. Your wound vac is working, and then it'll be time to troubleshoot something else. So we kind of worked our way from the wound vac to the wound itself. So the next thing that he had me do was connect the wound to the wound vac. So I don't have a picture for this. I should have put up a picture. But anyway, the next thing he had me do was connect the canister tubing to the sensor trackpad on the wound. So now the wound is connected to the wound vac via this tubing. So once everything was connected, he asked me to check for kinks. I looked at the tubing, there were no kinks. There are two clamps on the tubing connecting the wound to the wound vac. He made sure those were unclamped. Oh, he asked me to make sure those were unclamped. I unclamped them, made sure the tubing was free and clear of any obstructions, kinks, or anything that would block the wound vac from suctioning. So after that, we now checked for air leaks. So tip number two is to check for kinks in your tubing to resolve any blockages and to determine for sure that your problem is not coming from the tubing. Then you can go to the wound and the dressing that you did to check for air leaks. So checking for air leaks is tip number three. So for the air leaks, what you do is you turn on the wound vac machine, and if it's still not suctioning, the wound, if your black foam doesn't collapse down, what you can do is start to press around the dressing gently. Press around the dressing. As you press around the dressing, the black foam may start to collapse. And you may also find the source of your air leak as you press down. So let's say there is a hole somewhere in your dressing. If you put your hands over it, you will notice that your wound vac will start to suction. If you take your hand off of it, you'll see that you lose suction. So what you do once you find out the area that you have an air leak in is you put a piece of tape over that area so that you can get and maintain suction at your wound. So let's see a little video that shows us this. So see how there's no suction, the black foam does not collapse. Now, next thing is to press around looking for the leak, and you see how it now collapses. Okay, so tip number three is to look for air leaks by gently depressing areas around the wound and possibly on the foam itself so that you can find where the air leak is and resolve it by applying another piece of tape, clear tape over it. So tip number four, I have a story about this one. So I changed a wound. I went to go change a wound vac for a patient, and there was an error message on the wound vac. So the first thing I did was test the wound vac to make sure it was working. So what did I do? I put a canister on the wound vac machine. I left the little cap at the end of the canister tubing, and I turned the machine on, and it was giving me an error message saying the canister was not engaged. But the canister was on. So what I did was I pressed the canister into the wound vac machine a little more. I applied a little bit of pressure, and the wound vac started working. It went from zero millimeters of mercury pressure to 125 millimeters of mercury pressure. So I realized that the canister wasn't tightly secured to the wound vac machine. So what I did was I put the wound vac down. Once I put it down without the pressure coming from my hand, the pressure went down to zero, and I got that canister not engaged error message. So I put it down. I got myself some tape, and then I taped the canister a little tighter to the wound vac machine. I did that, and the pressure went up to 125. So I realized, okay, this canister is not properly engaged. I'll leave the tape on so that it can work properly, and then we'd need to get a new wound vac machine for the patient. So I went ahead, I changed the dressing, I connected it to the wound vac with the tape on it, and the black foam it collapsed. It was suctioning fine. But then I make sure to tell the patient to order a new wound vac from the company so that we could switch it out. So that is tip number 4 for me. If you see that you're getting a canister not engaged message, and you've applied the canister as you should, just apply a little more pressure and check to see if it will work for you. If it does, you can apply a piece of tape to keep it more secure, but the patient will need a new machine. The patient will definitely need a new machine. And as soon as that machine comes, the one that's not working properly, the malfunctioning machine, should be switched out for the new one. So that is tip number 4. Make sure your canister is properly engaged. And here is a little video showing how to apply the canister. Push it in to make sure it's properly engaged. All right. Tip number 5 is kind of a bonus tip, not really a big deal, but anytime I turn on the machine, the first thing I kind of do is listen for the sound. If the wound vac stays loud, I have no suction. No way, no how. I don't even need to look at the dressing. There is no suction. If the wound vac is loud, you definitely have an air leak or air leaks. Now, if the wound vac goes from loud and down to quiet, you probably have a good seal. So when I would turn on the machine, I'd listen, loud sound, okay, I have an air leak. And I would, trace my tubing. I'll just do all the everything like step by step. I'll trace my tubing. Remember, I always test my machine first, so I know my machine is working. Trace my tubing, make sure there's no kinks, make sure the clamps are open, and then I go to my wound and start pressing down around it. I'd find my air leak and put tape over it, and I'm good. Now, if the sound goes from loud to quiet, I know my everything is working well somewhat. Then the next thing I'll do is look at the pressure on the wound vac machine, because even though the machine goes from loud to quieter, if it doesn't get too quiet, probably means I don't have a good seal all the way, but I have some seal. So I'll look at my wound vac and look at the pressure on it. If it's at like 75 or 100, I need to do something because the prescribed pressure is usually 125. So I need to get it to 125 millimeters of mercury. So what I'll then do is start looking for an air leak. And once I find the air leak, I tape it up, go back to my machine. Or I listen for the sound as I'm pressing. If the machine gets quieter, I know I found my air leak. And then I look at the machine and I see I have 125 millimeters of mercury pressure. I put the tape over where the air leak is, and everything is all good. So that's tip number 5, is to listen to the sound that the machine is making. If your machine is loud, you probably have an air leak. If your machine goes from loud to quiet, depending on how quiet it gets, you may or may not have a good seal. Now, the machine doesn't have to be 100% quiet, although it does get that way. As long as you don't have an air leak alarm and you have a pressure up to 125 millimeters of mercury, you are good. There were times when I'd like try to get it super quiet, and the patient would tell me, it's usually this quiet. It doesn't get any quieter than this, so I'm fine. And we'd have no problem with the wound vac until the next wound vac change would go change the wound vac with no issues. So if you're kind of new to wound vacs, as long as you have your 125 millimeters of mercury pressure consistently, there is no air leak alarm. The wound vac is quiet. It doesn't have to be like quiet, like no sound, but like it has very minimal sound, is very low. You have 125 millimeters of mercury pressure, you should be fine. All right, so that is my last tip. I'm just going to share
It's not
with you
connected.
a video of sound. So this is
It's
loud.
not connected.
In this video, the wound vac is
It's not
loud, so
connected.
it's not connected. You heard it in the sound of the
It's
video.
not connected.
And in this case, the dressing will not
It's not
compress.
connected.
Now, this is where it goes from loud to quiet.
There you go. Boom. Good. Nailed it.
See?
Finish
Loud
it.
to quiet. I have
There you
another
go.
video
Boom. Good.
right
Nailed
here
it.
showing
Finish
what
it.
happens when it's loud. It
There you go.
means it's
Boom.
not working well.
Good.
Watch this. Right? And you connect it back, it goes quiet. Here, this is just loud. It's just loud. So you can see if it's working well, it goes from loud to quiet. And if it's not working well, it just stays loud. All right. I want to thank you for watching this video. I hope you found it helpful. Please like, share, and subscribe, and I'll see you in my next video. Bye bye now.